Mission and margin is the business of healthcare. Medical professional liability insurance premiums are expected to rise in a so-called hard market. BOH asked MPL underwriting expert Nat Cross of Beazley Group what 3 U.S. healthcare trends might reduce frequency and severity of med-mal claims and avert premium increases for providers.
We used to have the luxury of being able to draw the medical malpractice severity map in 4 different colours. Tort reform, those jurisdictions which had some sort of cap, be it on non-economic damages being pain and suffering or on the entirety, where obviously the best places for us to be doing business, and then low severity states, medium severity states and high severity states. We now just have 2 colours. We have bad and very bad, because there's been a normalisation of verdicts and settlements, and even places which heretofore would be considered benign are no longer in that category. What came to our rescue, though, back in 2001, 2002, the aforementioned tort reform, the emergence of patient safety and quality, and the transparency of information in that regard, driven by the Hospital Compare website and organisations such as Healthgrades and Leapfrog, which really gave the consumer, the healthcare consumer, more information about the choices they were making, as well as, here we are at the Cayman Captive Conference, improved risk retention by many insureds, so better stewardship of risk, having skin in the game. All of those 3 things conspired to lead to the improvement in profitability of the class back then. Unfortunately for us, tort reform has been knocked out in certain states but remains in many states. Patient safety and quality has never gone away, and captives have never gone away. So for us, the challenge is really trying to envisage what's going to change the mix now, because there's no silver bullet on the horizon which is going to fix things. So it's just a case of knuckling down, re-underwriting our portfolio, working with our insureds to head off this storm of litigation, so that we can bring things back to a more normal state of affairs.
Watch, listen, or read the full interview at bohseries.com or search for Business of Healthcare in our red logo.